Thank you, Paul, and good afternoon, everyone. A little different being here by myself today, but we'll work with it. I just have a couple things to let people know about. I know we've done a couple news releases this week, and so I just wanted to share a few things regarding COVID-19 vaccine, and then I think we can open it up for questions. As of this morning, 254,155 doses of COVID-19 vaccine have been distributed to North Dakota. Of those, 232,079 doses have been administered. 18.7% of North Dakotans have received their first dose of COVID-19 vaccine. 10.6% have received 2 doses. I continue to be amazed by North Dakota healthcare providers who are giving this vaccine as quickly as they receive it and working so hard and even offering weekends and evening clinics. And so just continued thanks to our healthcare providers who have been working on the COVID-19 vaccine effort. I did want to talk about the Janssen or the Johnson & Johnson vaccine. You might hear it used interchangeably. That became authorized this past weekend. This is the single-dose COVID-19 vaccine. It was authorized by the FDA under emergency use authorization this past Saturday. It can be used for people 18 years of age and older. So this is now the third COVID-19 vaccine that's authorized for use in the United States. Then over the weekend, the Advisory Committee on Immunization Practices met and voted to recommend the use of the Janssen vaccine for people 18 and older under emergency use authorization. They did not express a preference for one vaccine brand over another and just said that states should incorporate the Janssen vaccine into their current priority groups and allocation processes. And then our North Dakota COVID-19 Vaccination Ethics Committee met earlier this week and agreed with ACIP. And so we did start including the Janssen vaccine into our normal allocations and priority groups. The benefits of the Janssen vaccine, it's a single dose, which our other vaccines that are available do require 2 doses to be completely vaccinated. It can be stored at refrigerator temperatures, and so this probably doesn't impact the general public as much, but for healthcare providers, that's the traditional storage for most vaccines, and it makes it a lot easier for transport, mobile clinics, mass vaccination clinics. It did achieve an 85% efficacy against severe COVID-19 in clinical trials. Their clinical trials were held in 3 continents, and over 44,000 participants were included in the Janssen clinical trials. It did have similar efficacy across different ages, races, ethnicities, and people with underlying health conditions. In the clinical trial, the Janssen vaccine provided complete protection, 100% efficacy against hospitalization and death 28 days after vaccination. 2 of the countries that participated in clinical trials were Brazil and South Africa, where we're seeing a lot of the concerning COVID variants. And so it did have proven efficacy against the variants even in those countries. And then also in a small subset of clinical trial participants, the vaccine was 74.2% effective against asymptomatic cases. Now, this wasn't statistically significant because it was less than 10% of the trial participants, but I do think it's positive information about the potential for preventing asymptomatic cases with the Janssen vaccine. The vaccine was also shown to be safe, very similar to most vaccines that are used in the United States. Injection site pain, fatigue, headache, fever, no anaphylaxis, which is that severe allergic reaction that you might have heard about, was identified in clinical trial participants. The one thing I want to stress about the Janssen vaccine is that you cannot compare the Janssen vaccine to the 2 mRNA vaccines in terms of efficacy, as there has not been head-to-head clinical trials done comparing the different vaccines. These vaccines were, the clinical trials were done at different times in different countries, included different people in their clinical trials, and so you really can't compare them one-to-one. North Dakota's initial allocation of the Janssen vaccine is 6,300 doses. Those doses are going to pharmacies and urgent cares across North Dakota. We really wanted to make sure that anyone who wanted to receive the Janssen vaccine would have access to it, and our pharmacies that we have enrolled are across the state in every county, and so we're making sure people do have access. And providers should start receiving this vaccine on Friday, March 5th, is when we'll receive our first shipments of this vaccine. One question that may come up is, what is the best COVID vaccine, or which COVID vaccine should I get, which brand? And I just want to stress that the best COVID vaccine that you can get is the first vaccine that's offered to you. And so you don't really need to worry about shopping for a brand. All of these vaccines are highly effective and safe. And while vaccine is still limited in the state, I will say that our allocations continue to increase each week. And so this week, North Dakota will be receiving 9,360 Pfizer doses. And again, just as a reminder, these are first doses. 7,500 Moderna doses. And then, of course, the 6,300 Janssen doses that I mentioned. And then additionally, Thrifty White pharmacies, if you remember, this is the federal pharmacy partnership program. They receive vaccine directly from the federal government. Thrifty White Pharmacy will be receiving 6,540 doses, and that's split amongst all three brands of the COVID-19 vaccines. And then also starting this week, Coal Country Community Health Center in Beulah, our federally qualified health center, will be receiving direct allocations from the federal government, and they're receiving 100 doses this week. And so we did receive word that our allocation is also increasing for next week. And so next week we'll receive 10,530 Pfizer doses and 7,500 Moderna doses. We won't be receiving any additional Janssen doses until our allocation of March 23rd. The federal government is smoothing out the manufacturing process, and so we will receive more Janssen the week of March 23rd. And then, of course, Thrifty White will continue to receive doses, as will Coal Country Community Health Center. And then Spectra Health, another federally qualified health center that's located in Grand Forks, will also start receiving doses directly from the federal government. Something else I wanted to mention today was that late yesterday, the Biden administration announced a goal to have every child care worker and K through 12 employee to receive a dose before the end of March. North Dakota is on track to already do this. Child care workers and K through 12 employees were included in Phase 1B of North Dakota's vaccination plan. Many providers across the state are already vaccinating in Phase 1B. Thrifty White Pharmacy has already opened up vaccination to anyone in Phase 1B, including child care workers and pre-K through 12 staff. And so if you're a child care worker or teacher, please take a look at our COVID vaccine locator or work with local public health. I know local public health is working with a lot of schools in the area to vaccinate school staff. As I said, most providers are vaccinating in Phase 1B, but we have had some that have moved on to Phase 1C. And again, this is on our COVID vaccine locator website. It really does vary by local area as to which priority group is being vaccinated. And we've encouraged healthcare providers to move quickly through the priority groups. And so if they open up appointments for vaccination and they're not seeing people sign up, they're going to keep moving on to the next priority group. And even if they do move on, that doesn't mean previous priority groups can't get vaccinated. The North Dakota Department of Health and Thrifty White are shifting allocations where we see an increased need or where we see providers that are in higher priority groups. And so we will continue to do that as we receive increases in allocations. And then I just wanted to stress, I think we might have some people waiting for their provider, their physician to call them to come in and get vaccinated. That's not necessarily going to happen. So I wanted to stress, don't wait for somebody to call you to come in for vaccination or to schedule an appointment. You should access vaccine as soon as it's available, whether that's at local public health, your pharmacy, or your private provider office. We also have heard that many people have gotten on multiple waiting lists for vaccination, which is fine. They're interested in vaccine. But I just wanted to remind you, if people are on multiple waiting lists and then do go ahead and get vaccinated, please take your name off of other waiting lists, because healthcare providers are spending a lot of time calling down these waiting lists to find that people have already been vaccinated. So that would really help out our healthcare providers if you could let them know that. Again, for anyone who doesn't have access to the internet or is struggling to find vaccine and your priority group is up for vaccination, you can also call our hotline at 866-207-2880, and then make sure you press the number 2, and then we have staff ready and available to assist you in finding vaccine. And if we can't find vaccine, we're taking down contact information and calling people back the next week when more doses come to the state. This week, the Department of Health is sending letters, about a little over 62,000 letters, to people 65 and older who have not yet received a dose of COVID vaccine, according to the North Dakota Immunization Information System. And on there, we're directing people to the COVID vaccine locator, and then, of course, to our hotline as well if they need assistance. I think there's some confusion on underlying health conditions and who should be vaccinated and which underlying health conditions. And so I just wanted to mention that people 16 to 64 with 2 or more underlying health conditions can be vaccinated now. Don't wait. You are at high risk for severe COVID disease. And so underlying health conditions include current and former smokers, obesity, cancer, diabetes, heart conditions, Down syndrome, kidney disease, COPD, but that's not a finite list. I want to mention these are common conditions that we have data showing severe COVID-19, but some people might have rare conditions like cystic fibrosis. That will probably put you at high risk, so talk to your doctor and see if you're at high risk for COVID-19. Just a plug, if you're receiving the 2-dose vaccine, please remember to go back for the second dose. You really need 2 doses to ensure high protection. And then we did send out a news release earlier this week about out-of-state residents, just reinforcing our policy regarding out-of-state residents. North Dakota will vaccinate out-of-state residents who live or work in North Dakota or who have an established healthcare provider in North Dakota. So if you're a Moorhead resident and your doctor is at Sanford Fargo and you meet our priority group, then we have told providers that they can vaccinate those individuals. Even if you've already had COVID-19 disease, you should still plan on getting vaccinated to prevent reinfection with the virus. Variant viruses are becoming more common, and so getting vaccinated will boost your immunity to COVID-19 and provide more protection. Because reinfection is rare, especially within 90 days after having the disease, you can wait 90 days until you get vaccinated. I also wanted to mention there are some, I talked about the Janssen vaccine, but there are other positive signs that COVID-19 vaccine does prevent asymptomatic transmission. There are 2 studies in Israel showing the Pfizer vaccine reduced asymptomatic cases. And then, of course, in the Janssen clinical trials and Moderna, there were small subsets of participants that show the vaccine also reduced asymptomatic cases, which then would theoretically translate to preventing transmission. And then I talked about the ACIP meeting this week. They also did receive a lot of safety data about what's happened so far in the United States in terms of safety in COVID-19 vaccine. And again, all of the data is highly reassuring that COVID-19 vaccines are safe. They were presented data, and that's for more than 75 million doses being administered in the United States. No concerning safety signals were identified. They specifically looked at data for pregnant women who were vaccinated and their outcomes. There were no concerning safety signals. There was not a higher rate of miscarriage or anything like that associated with vaccination than what would be seen in the general population. North Dakota definitely continues to be open. Our schools, our businesses, our restaurants are open. And we just want to make sure everyone knows that vaccination is the safest and most effective way that we can stay that way. So we encourage everyone to continue to be vaccinated. And to learn more about COVID-19 vaccine, please go to CDC's website or the Department of Health's website. We have a fact sheet on our website that's really good. And then, of course, our COVID vaccine locator, which will tell you which priority groups are currently being vaccinated in your area. So that's what I had to share today, but I'm happy to open it up for questions. Yes?
Molly, so the Biden administration announced plans to get enough vaccine to vaccinate every adult by the end of May. Does the state have the infrastructure to keep up with all of those increased vaccine doses?
Yeah, and I think everyone can hear the questions. Or do I need to repeat them? Yes? Okay, everyone can hear. Yeah, the Biden administration did announce that everyone who wanted a vaccine should be able to receive it by May. We have taken a look. We've surveyed our providers. They've reported that at a minimum, they can give 60,000 doses a week. And then also we have additional infrastructure that could add another 7,500 doses a day to that we haven't used yet. And then also that we haven't even used any of our National Guard friends that have helped during our response. And then as a last resort, if we needed to, we could reach out to FEMA for assistance. And so we do feel like we have the necessary resources to keep up with vaccination if there were that many doses to come our way. Yep.
So the U.S. Conference of Catholic Bishops has come out against the Johnson & Johnson vaccine because of the use of aborted fetuses in the ingredients. Can people opt out of getting the Johnson & Johnson vaccine and go a different route with either Moderna or Pfizer?
Yeah, so the U.S., and I have to get the Conference of Catholic Bishops, I did read their statement last night, and I just want to read it word for word so that it's clear. The Congregation for the Doctrine of the Faith has judged that when ethically irreproachable COVID-19 vaccines are not available, it is morally acceptable to receive COVID-19 vaccines that have used fetal cell lines from aborted fetuses in their research and production process. However, if one can choose among equally safe and effective COVID-19 vaccines, the vaccines with the least connection to abortion derived cell lines should be chosen. Therefore, if one has the ability to choose, Pfizer or Moderna's vaccine should be chosen over Johnson & Johnson. I think right now with vaccine being limited, it's difficult to offer choice for vaccine. We're currently not offering choice for providers as to which vaccine they can offer. And so it will be difficult, and it may mean, ultimately people can choose if they want to receive it or not. That's their decision, of course, and they need to make that decision on their own. But it may delay them in getting vaccinated if they were eligible to receive the Janssen vaccine and then decided to wait for a Pfizer or Moderna dose, but that would be their decision. I did want to read another part of their statement that I think is important, and that is that they stated, given the worldwide suffering that this pandemic is causing, we affirm again that being vaccinated can be an act of charity that serves the common good. And so I did want to reiterate that they still are definitely supportive of vaccination overall. I just think it might be difficult quite yet for people to choose vaccination, but ultimately they have to do what's best for them. Any other questions? Yep.
The press release that went out yesterday noted that some providers have already moved on to phase 1C of the rollout. Does the Department of Health have a sense for why some providers are moving at a different pace than others?
Yeah, that's a good question. For phase 1C, some providers have moved on, and it does appear that it's mostly in the rural areas of the state. I think some of what is happening is that when we allocated out vaccine, we've been allocating it out based on county population. But I think some people living in rural areas have gone to urban areas to be vaccinated because that's where their traditional healthcare provider may be. And so I think we didn't maybe account for that in our allocation process. So that might be some of it, that they were just vaccinated in a different county. I think also some of it could be uptake related. We might be seeing more hesitancy in different rural areas, and that's why we're not seeing as much vaccine or that they're able to move faster through phase 1C. But as I said, when we receive increases in allocations in the state, we are shifting those more to the urban areas where people are still vaccinating in earlier priority groups to make sure everybody gets caught up and is at somewhat the same level of vaccination in terms of which phase we're in.
Question from online, Gene Shemp, Hometown Radio Group. We seem to be moving through the priority phases much more rapidly in the past couple of weeks. Do you have statistics on the number of people in various groups who have been vaccinated, and are you finding there's more or less interest in specific groups such as younger people?
Yeah, on our website, we do show some different age groups on our dashboard that people can take a look at in terms of vaccination rates. It's hard to say. We have looked at 75 and older, 65 to 74, and we are seeing high rates of vaccination there. Like I said, right now we have 62,000 North Dakotans that, at least according to our system, that are 65 and older have not yet received a dose of vaccine, and that's why we're sending them a letter. Now, some of those individuals might have been vaccinated by Veterans Affairs who were not getting their data on who they're vaccinating, so that's possible. And we also know that some North Dakotans are getting vaccinated down south in Arizona, Florida, wherever they are for the winter. So there's some of that going on. But I do think as we move into younger age groups, we are seeing that we're moving through them faster. But I also think, for instance, the 16 to 64 age group with underlying health conditions, I think a lot of people don't really self-identify as having underlying health conditions is some of what's going on. And so I don't know if it's hesitancy or just not knowing that they have underlying health conditions. It's much more difficult to communicate high-risk conditions for vaccinations than it is to communicate age-based recommendations for vaccination. But we aren't really able to say vaccination rates, for example, by teachers or childcare workers, because that's not indicated. We don't have occupation or anything like that in our system. But I think we always knew as we moved to younger age groups that we might see less uptake in the vaccine. I think there's a core group of people when this vaccine came out were like, I'm getting it now, I can't wait to be vaccinated. I think there's another group who are kind of doing the wait and see. I want to see my friends get vaccinated, my coworkers get vaccinated. And then I think there's a smaller group who are just saying, I'm absolutely never getting this vaccine. And so some people just might take a little while to decide to get vaccinated. Yep.
A few days ago, there was a press release reminding the providers about out-of-state vaccinations. What about North Dakota makes it kind of attractive for people out of state to come here and try to get a vaccine?
Well, I'm sure it's our weather. No, I don't. In terms of out-of-state vaccination, I think a lot of it has to do with, if you think about North Dakota and where healthcare is located in terms of our border states, North Dakota pretty much has all of the healthcare on our side of the border. And so I think that's where some of it's coming is that's where the providers are for people in rural Minnesota, rural South Dakota, rural Montana. And so I think we have some of that going on. I know some of our out-of-state doses, over 4,000, were healthcare workers that work in North Dakota. So that was a large percentage of those doses. Otherwise, I think every state has different priority groups, which has created some confusion. And so when North Dakota is vaccinating people 16 to 64 with high-risk conditions, and Minnesota isn't there yet, it's just naturally going to cause people to want to come over to North Dakota to be vaccinated. I also think we were vaccinating our 65 and older a bit quicker than Minnesota, which is probably what happened. But we have reiterated that it's only people who live in North Dakota, work in North Dakota, or have established healthcare providers in North Dakota. Yep.
And Molly from Valley News Live asked, in regards to the out-of-state vaccinations, Valley News Live spoke with Cass County health officials, and they haven't seen an issue with people coming out of state to receive the vaccine who don't meet the criteria. Where in the state has this been an issue the most?
It's actually been a statewide issue when we looked at the data. There's a number of providers who have vaccinated out-of-state residents. We specifically pulled data and looked at, we have it by state, but we also looked at Minnesota specifically by different cities because we were okay with Moorhead and East Grand Forks, but we had heard rumors of people coming from Minneapolis, but it was statewide. I mean, even people flying into Bismarck to get vaccinated. I will say for public health, it's a little different as they routinely only serve people in their jurisdiction. I think it's more complicated for private healthcare providers and pharmacies that see people across different states.
In regards to the Johnson & Johnson vaccine, some would say it's more convenient because it is one dose. Is there a specific group or age group that you guys would recommend public health or private sectors to vaccinate, like essential workers, to use this so they don't have to come back for a second dose?
Yeah, the Janssen vaccine or the Johnson & Johnson vaccine with being a single dose is definitely more convenient. And so it does lend itself to employer-based vaccinations, mobile vaccinations, but really also anyone who doesn't like getting a shot if you only have to get one instead of two. And so we haven't expressed a preference for a certain group to receive that vaccine. Again, our message to the public is the best vaccine to get is the first one that you're offered. And so it will be at our pharmacies. We wanted to make sure it was in all locations of the state. And that's also a good place to have it. Pharmacies traditionally don't necessarily have freezers on hand, and they do have refrigerators. And so that's kind of another reason why we put it into pharmacies. And pharmacies for flu vaccinations play a large role in vaccinating employers. And so we thought they could use the vaccine to do a lot of employer-based vaccination as well.
Talk some about how vaccine hesitancy could become a big issue in the subsequent phases of the rollout, or the phases that we're getting to now. Do you have a sense for how much larger a portion of the population may be hesitant or skeptical of getting the vaccine in these later phases of the rollout compared to what we saw in like phase A, for instance?
At the Advisory Committee on Immunization Practices meeting this past weekend, and I want to say it was on their Monday meeting, it might have been it was on their Sunday meeting. They showed a map, and there was a U.S. Census Household Pulse survey that showed results for all states, and I will say North Dakota was one of the lighter colors, and I can't remember the range, but it was below 50% of adults who had not yet received a dose of COVID-19 vaccine were planning to receive a dose of COVID-19 vaccine. So the survey was people who had not yet received a vaccine, what percent would be willing to, and it was just under 50%. But it was concerning because North Dakota was one of the lighter colors, and so we do know that we're going to have to address quite a bit of misinformation out there about the vaccine, really talk more about the safety. I'm hoping now that even today we might be at 100 million doses administered in the United States. I haven't looked at CDC's website yet today, that it's more reassuring to the public that we have a lot of safety data on the vaccine and that they can feel comfortable receiving it. I also think in North Dakota, we had a number of people who had COVID and may just be wondering, why do I need to get this vaccine? And like I said, your immunity is not going to last, permanently. We're concerned about reinfection. We're concerned about variants. And so we really want people to be vaccinated, especially if it's been longer than 90 days since they had COVID-19.
One follow-up on that. On the ethics committee call yesterday, the public health director for Rollout County said that her county, that she was sort of predicting that her county would soon get to a point where there would be more vaccine supply in the county than there were people who actually wanted to receive the vaccine. Mm-hmm. From just a distribution standpoint, do you feel like there needs to be any sort of adjustment in terms of how the state is distributing vaccines to different parts of the state relative to how many people in that part of the state want to receive the vaccine?
Yes, I think we are going to be watching which phase everyone's in and be moving vaccine around according to where it's needed and where there's demand. Rollout County is a little different as they have Indian Health Services, who's receiving direct allocations from the federal government, and IHS has received a significant number of doses, and so that might be part of the reason why they have so many doses and we're able to vaccinate early. But we definitely, for the vaccine that the state is able to maneuver or allocate, we'll be moving around doses based on demand and where it's needed. Yep.
Todd McDonald from Prairie Public Radio and Gene Shem from Hometown Radio Group both ask pretty similar questions on what level of vaccination percentage do you expect the state to attain, and what do you feel would help the state attain herd immunity?
I don't know what level of vaccination coverage the state is going to attain. Our goal was 70% when we initially wrote our plan. I think national experts now with variants have been discussing a herd immunity level of 70 to 85% potentially needed, depending on the variant. I know for influenza vaccine, though, we only usually vaccinate, I think last year it was 56% of the population. So that 70% goal that we initially set was rather lofty. And so I think if we got to the same level, at least as influenza, I think that would be good. I would like to see it higher than that. I think it's also going to depend. The Moderna and Pfizer vaccines are currently in clinical trials for adolescents, 12 to 17, and so that will add, more people that potentially will be recommended for vaccination in the future. So I don't know what a realistic level is. I would think we could at least get to the flu vaccination coverage rate level. Yep.
Will the subgroups like the corrections population and the homeless population mentioned in the vaccine ethics committee still be allocated some of this Johnson & Johnson vaccine?
Yeah, so our initial allocation of the 6,300 doses is going to pharmacies and urgent care, but our Department of Corrections has expressed an interest in the Johnson & Johnson vaccine. And we expect there to be quite a number of doses of the Johnson & Johnson vaccine available, especially towards the end of March. And so likely we'll continue to send that to pharmacies, but it will probably be available for the providers you mentioned as well. And also, if providers are enrolled in our program, they are able to transfer amongst each other. And so if local public health wanted some doses for homeless, I think they could work that out as well locally if they wanted to use some Johnson & Johnson from a pharmacy. Yeah.
Sort of a broad question, but now that we're a few months into the rollout, North Dakota's been one of the national leaders in the rollout. I'm just wondering if you can talk about what you think is the biggest hurdle or the biggest challenge as we get to the broader segment of the population.
For 100%, the biggest hurdle is going to be vaccine hesitancy. There's a lot of misinformation out there about this vaccine. And understandably, a lot of people see it as something that was rushed through. I think people need to realize that mRNA vaccines have been in development for decades. The adenovirus vector vaccine, the Janssen vaccine, Johnson & Johnson has an Ebola vaccine using the exact same platform already approved for use in Europe. They're in phase 3 clinical trials for an HIV vaccine using the same platform. So it's not like we just started from scratch, last year when the virus started circulating to develop these vaccines. This has been years in the making. And I think some people, it's just going to take a bit of time. They want to see their friend get vaccinated. I think we're seeing that even, I know we've talked about long-term care vaccination rates. Every week when I get long-term care vaccination rates, they're slowly increasing in terms of the number of staff that are willing to be vaccinated. And so I think it's just going to take a bit of time for some people to make that decision to get vaccinated, but we just have a lot of work correcting misinformation that's out there about the vaccine. Any other questions? No? Okay. Well, I just wanted to thank everyone for coming today and continuing to put out information about the COVID-19 vaccine. Thank you. And if anyone has any additional questions, you can reach out to Paul's probably better at getting back to you than I am, so I would reach out to Paul. But thank you, everybody, for being here and on the line.